Hi everyone, again from Taj Clinic, the other interactive session that we do on every Sundays. I hope a lot of people have joined us live. So, like as we do on every Sundays, today is also we have come up with a very interesting topic. It is vitiligo. Vitiligo is the white patches that we get on skin, which is a very common problem bearing a lot of psychosocial effect on the people who get that. So today we are going to do a brief presentation on what vitiligo is, what is the clinical presentation, what are the different treatments available, and what are any surgical procedures, newer developments in the treatment of vitiligo, all the newer things we are going to discuss very briefly to give you an idea to all the general public and also the doctors if anyone is watching. So today we are joined by Dr. Tajuddin and Dr. Jyoti from our clinic. And we will start off with Dr. Tajuddin giving a presentation on vitiligo, what is vitiligo, and different treatment modalities, surgical treatment modalities. Over to you, Dr. Taj. So you can take over with the presentation. Can you hear me?
There is some problem. Yeah, now maybe.
Yeah. You're back.
Can you hear me now? Yeah.
Yeah.
Yeah, I gave the introduction. I'm not sure whether you have
Can
heard
repeat.
it or not. Yes. So today we are going to talk about vitiligo. It's a very common problem, and it's a very mostly a cosmetological problem, giving a big psychosocial effect on people who got that. So today we are going to talk about the causes and mainly the treatment modalities, the latest and the newer trends in the treatment of vitiligo. We are joined by Dr. Tajuddin and Dr. Jyoti from our clinic. And first, Dr. Tajuddin will start off with a presentation on vitiligo and the latest surgical treatment modalities. Over to you, sir.
Thank you very much, Dr. Priya and Dr. Jyoti. And that will take 1 minute for me to take the presentation
Sure.
from the doc. Okay, please hold on.
In the meantime, if anyone watching live have any questions, please put it in the comment section. We'll try to answer it.
Most of the people who are watching this live may not be familiar with the term vitiligo. So they may be calling it by another name or different name in their regional language. So it's a condition where you get white patches on the skin. So some people call it as leukoderma, some people call it as vitiligo, or they may be calling it in their own language.
Now the screen is visible.
Yes, it
Yes.
is visible.
Yeah. Now again, as we said, we'll be talking about vitiligo today. Then what are the causes? How we to manage? And already talked about the social, psychological impact for the people who is having vitiligo. We also will be talking about uh, management part, and whatever the questions you have, you can keep on asking while I'm presenting the slides also. We three will be Dr. Tajin, myself, Dr. Jyoti, and Dr. Priya will be answering all your questions. To introduce, what is vitiligo? How our skin has a pigment called melanin that is present in our normal skin. That's a pigment which gives our normal skin to the color. I mean, our skin, or normal color to our skin. Okay. So when the melanin produced in excess quantity, we'll get pigmentation, hyperpigmentation. When it is in less quantity, then we'll get hypopigmentation or less pigmentation. So that's how it happens. So more melanin is produced, we'll have darker skin, and less or no melanin is produced, then we'll have lighter or vitiligo skin. That is as simple as that. It affects around 1% of the world population. It can start at any age, but half the people affected by vitiligo are below the age of 20 years. Sometimes disease can progress, can be lifelong. Sometimes there will be remission, and again it will flare up. So we can reduce the color, we can give a better life or better color to the skin, but the cause is really unpredictable. As I said, we do have melanocytes in the basal layer. That is the layer deeper part to our skin. In that we have got melanocytes. These are the melanocytes. So these melanocytes will produce melanosomes and then melanin. So melanin will slowly get up to the surface of our skin, which will give our normal color. When the melanin is more in excess, we'll have darker skin. And here there is no melanin, melanosomes, and we'll have whiter skin. Okay, so we'll have white skin here, and if it is no here, we have normal skin. Then so many people have this question: is it hereditary? Yes, it is hereditary, but only 1/5 of the patients will have some hereditary factor, either father or mother. And if you have vitiligo, it doesn't necessarily follow that your children will get this. So there are different types. Commonly, it is like focal, there is small patches. Sometimes it can be segmental, like one-sided long patches, only one-sided. This is one side of the part of body. Then can be also acrofacial. Acrofacial means in the end, like around the mouth, around at the tip of the nose, at the hands, so the hands and the feet. This is what acro. Acro means the end. So acrofacial, the face is included and tip of the parts, tip of the body part. That also will be involved in acrofacial type. Generalized is there a vitiligo vulgaris. That is all over the body you might get white patches. Universal also like almost like more than 90% body is affected by this melanin deficiency. That's called universal. Then what are the treatment plans? You have to plan the treatment according to the duration of the disease, the age of the patient, and how they take it. Because psychologically also is a problem. Some people take it as a very serious disease. Some people think that it is contagious, and there is still a taboo against this disease. And the treatment plan should be like first one is sunscreen. Actually, we are losing melanin from our skin. So melanin has a property that it will protect our skin from the sun. If melanin is absent, then it will it will give harm to our skin. It can damage our skin because that protective activity is removed because since melanin is not there. So we need to use sunscreen when you have vitiligo. Then simplest form of treatment will be local application and phototherapy, excimer, light skin treatment. That also medical management. Dr. Priya will be talking on. We also will discuss on some surgical part. Okay, and skin camouflage, all the things we'll discuss in the end. And we also have phototherapy that also will discuss. And different types of surgical methods are available. The first one is grafting of melanocytes rich tissue. That is tissue grafting. That's like ungrafting, mesh grafting, blister rope grafting, split thickness grafting. All these from the tissue. Okay. Then wrapping of only melanocytes or keratinocytes. That is cellular grafting. Maybe cultured melanocyte suspensions also available. But there are so many. We are not mentioning all the surgical methods. What are the commonly used surgical methods only will be discussed. But if anybody is from a doctor's community, they can ask us what are the other surgical methods. We are ready to answer. And what are the differential diagnosis? Some disease can mimic vitiligo, like typical leukoderma, like after maybe when you use hair dye for a long time, some people may develop depigmented, that's white patches around the for frontal area or around the ears. It's chemical leukodema, or maybe some people working in some chemical factory can develop leukodema. That's a chemical leukodema around the tips of the fingers. When Addison disease also has white patches, then leprosy could be confused with this vitiligo, leprosy, and we'll have to investigate on that. Tinea versicolor is a fungal infection, and tuberous sclerosis, and halonevus, nevus animatus, nevus depigmentosus, bebalism, pityriasis alba, and post-inflammatory depigmentation. Like when we have some trauma, the melanin also will be removed along with the skin, then that will lead to white patches. And maybe sometimes people keep on using steroid creams, self medication. So then that also can cause white patches on the skin. And sexually transmitted diseases like AIDS and syphilis also can cause hypopigmented white patches, which mimics vitiligo. And these are the surgical methods. Now I'll just show you few video clips how surgery is being done to control the vitiligo disease. Let's see. So this is a little longer video. So please watch and just see. This what we are doing is, as we said, this is for the doctors community also. So what we are taking is the trypsin. So we can take either 3 ml to 5 ml, then we transfer it to this petri dish. Then after this, what we'll do is we'll take a graft from the donor side. Donor side is usually what we take is from the thigh, or whether the pigmented area is more. Thigh or buttocks area we can take. This is after taking the graft. That's what we are showing. This is incubator. We have to, after taking the graft, we have to keep this graft in the incubator for some time. And we have to prepare the recipient area. Recipient area means where we are going to treat. Suppose a patient has white patches on the forehead, we have to remove the vitiliginous skin from there. Then we'll keep the cells there, so that from the cells, melanin will be transferred to the vitiliginous area. That's how it acts. So we'll do the surgical method, all the surgical methods, only if the vitiligo is stable. And we don't know when it is stable. There are so many deficiencies. I mean, sorry, I'm sorry, really sorry. There are so many deficiencies, the definitions for stable vitiligo. So, like some people say, if vitiligo patch is not increasing in size for more than 6 months or 1 year, and no new patches are coming for a period of 6 months to 1 year, it is considered as stable vitiligo. But any time, even after 10 years, 20 years, new patches can come. So we cannot say that it is fully stable. So if it is about 2 years, 3 years, we can do the surgical method. What we are doing here is a very superficial part of the skin we are removing. We can use the simple shaving blade or the graft blade. So here, this patient, we are doing both the techniques. Here is our own method. There will be some variations in the normal procedure. We do have our own method. So this also like this blister root grafting. What we are trying to do is to make a blister, and we will keep this negative pressure with the syringe and keep it for 1 to 2 hours. Then what will happen? This is what will happen is the blister will be formed, and that blister will take and put it on the vitiliginous area after removing the superficial part of the vitiligo. And that is this also for the melanocyte transfer, not for the blister root grafting. So this video has been repeated. Unfortunately, we couldn't do the editing well. I regret for this. So this is for melanocyte transfer. So this is what we have got. Then soon after taking out from the incubator, we have to put antitrypsin and will separate the cells. Whatever the things which is not required to remove, then we'll collect only the cells. In that, apart from melanocytes, we'll have keratinocytes also. But it's okay. We do both. Then it is better we put both together. In our experience, it has given excellent results. Some other centers failed after doing this MKT procedure. We did this, then we have been successful. So we follow our own method, little changes, not our own method. So we have made little changes in this. Then put the graph. Just like lasers, when we started in 1999, there were no one to ask. We have to find our own methods to do laser treatments. Because 1999, very few people were having lasers. Just like that, in Vitiligo also, not many people were doing it. They were publishing different data, and then we started our own, and our relatives first, and they were happy. Then we followed like this. As I said, the full steps. There may be some variation when you see this procedure. So this is how we do the melanocyte keratinocyte grafting. They will take the only suspension after the centrifuge. They'll put only the cells. We'll apply it's like a paint on the vitiliginous area. What we do is the recipient area, the upper part, we'll remove it with CO2 laser in ultra pulse mode. Only superficial part will be this is a CO2 laser in ultra pulse mode. Then we'll remove only the upper part of the skin. Then there we'll put, yeah, this patient you can see this is CO2 being applied, ultra pulse mode, all the area where we want to put the grafts. Then we'll wipe off with wet gauze. You can see the bleeding point. That means you have reached the upper dermis. Then we'll start putting the grafts. That means only the cells. Okay, sometimes what are the keratinocytes there? That also we'll put above this so that we can act as a package also. So it can also contain melanocytes. That's what I meant by package. So we don't want to lose any of the skin, whatever we are taken. Not extra unwanted fats and all will remove. This is a little of modification what we do. Then that's the thing. Well, then that's long videos and it takes a lot of time. So this is a blister root grafting. I've already seen how the suction blister is being formed. This is for the lips. Most of the time we use this technique for the lips. So it's fantastic result will give for the lips because color matching is superb compared to other parts of the body. For the lips or any mucocutaneous junction, we can do the blister root grafting. No, even then other body parts also we can do. There may be slightly color mismatch if you are doing to the other parts of the body. So lips we prefer blister root grafting compared to any other sort of grafting. So like this thing, like what we are giving is a local injection to numb that area. Not only to numb that area, when we give injection, you can see the lip has become bigger. So it will be very easy to place the grafts. Again, the upper part of the lip, we are removing it with ultra pulse CO2 laser. Then we'll remove this. Whitest thing is the frosting. Then after, we'll give multiple passes, ultra pulse in CO2 laser. Ablative CO2 laser. So after that, with the wet gauze, we'll remove the superficial part. You can see this We are removing the upper part of the skin. Whatever is left to remove, we'll do another pass, multiple passes, not very deep. You can see this nowadays we are using only the focus mode. So lip has become bigger due to the injection what we had given. This is good actually. When it's bulged, it's very easy to place the grafts. Here, what we are going to keep is this is the blisters are formed. You can see we are removing the syringes. With the negative pressure, the blisters are formed, and all the blisters will be removed. So, the roof will be removed, and the blisters will be cut on the piece of removed skin on the recipient area. Just now we have seen over the lip, upper part of the skin has been removed, and this blister roof will be removed. It will be cut on the glass slides. This is the best method because otherwise you won't know which is surface, upper part or lower part. So this way this is the easiest method. Then this directly we can place it over the lip. This is how we'll keep the graft on the lip. Now you can see one side of the lip, we applied the graft. This is a very superficial. It's not the entire skin. This is the blister you see, when you get boils or get burns, you'll see the blisters. So we are taking only the roof of the blister and keeping it on the vitiliginous area after removing the superficial part of the skin. For the doctors, we are telling they will remove the epidermal layer to reach the papillary dermis. Then these are the medical lines. I just want to see, I just want to show you this video because this is excimer light, also known as targeted phototherapy. Here, near the eyes also we can treat with this light. This is phototherapy. Then 308 nanometer excimer light and excimer lasers also is available. This is what we are showing is excimer light. You can see near the eyes also we can treat with this. Eyelid also we can treat with this. So the penetration is not that much because it's only 308. Longer the wavelength, penetration will be more. This is only 308, so penetration is less. And I also wanted to show you this 308 we can treat on a hairy area also. When suppose in the scalp we'll have white patches, along with that we will have white hairs. Here we can use a brush-like tip so that the light will reach everywhere. So these are the surgical. So many are there, so we don't have much time. So that's all about the surgical. This is. Then I'll show you some few pics before and after picture also how we are treated. What is the result? I think it's already 7:24. I will finish it off fast. You can see this patient. Patient, the forearm, the photo is not that good. And then even then, I'll show you this area has been repigmented. That's the pigmentation has come back. Then this before and after picture is after medical line of treatment. You can see good improvement. And if this lady and this is the face region, younger lady and older lady. And these are small patches. Is good for blister roof grafting. It has been stable since more than 4 years, and these patients wanted to remove that. Then we have got excellent results. And sometimes you won't get good results as much as expected. This also on the face. This also by medical line of treatment. You can see this patient has the leukotrachea, the white hair also this patient has. So this will take long time to get response, but hairy region when we treat, the treatment response is usually faster. It's also eyelid. You see, this is after targeted phototherapy. And here near this area also we can treat with the targeted phototherapy or excimer light. And these are most from all this area is by surgical methods, upper lip. So we always, if it is stable, as I said, nothing is stable in vitiligo. So these areas, you see, got excellent results. So far, we have not seen any recurrence on the lips. So if at all we want to go for surgery and any patient wants to get vitiligo, better get it on the lips. All right, that's been done, and that's all my presentation. And Dr. Priya can take over.
Yes. Thank you, sir. Thank you for the presentation.
Thank you.
So, as we all know, vitiligo, as I mentioned, it's the white patches on the skin. So, it's more of a cosmetic disease. It is not going to affect your health in any way, but it can play a major role in the psychosocial appearance. And many people come to us with depression and a lot of emotion bearing to the disease. So, vitiligo is not that easy to treat. It takes a lot of time, patience, and compliance from both the doctor and the patient. So, after the counseling and other things, we go with the plan. We don't start with the surgical treatment immediately, depending on the presentation, as Sa mentioned, and the years of presentation. We start with the medical management, and then, if needed, we go for the surgical management. The medical management also depends on which part of the body the patches are, the white patches are, and their emotional status and everything. So first in the medical management will be the topical application. So one of the pathogenesis of vitiligo has multiple pathogenesis and theories. One of it is an autoimmune basis. So majority of the topical medications involve around anti-inflammatory effect. So some potent steroidal creams, calcineurin inhibitors, vitamin D analogs. These are the main commonly used topical creams, and a doctor will select the cream depending on the area, which part of the body the patient is going to apply and how wide the area is. So depending on that, the topical creams are being prescribed. And the other topical thing is Soralin. Soralin has both topical and oral. Soralin is a plant-based medicine, which is a photosensitizer. So when you take or apply Soralin and then get exposed to sun, we see pigmentation in the areas where it was white before, where it was depigmented before. So there are creams which you can apply or tablets you can take, and the effect of it will be like after 1.5 to 2 hours. The peak effect of it will be after certain time in the body, and we'll ask the patient to expose themselves to a natural sunlight, or they can go to a clinic where a phototherapy is available and they can get exposed to a ultraviolet rays. So it is called a PUVA therapy. So PUVA salt, PUVA is also a oral and a topical treatment. And the other oral things, like if the patient is very anxious and they are continuously getting new patches, we also give like a mini pulse dose of methylprednisolone or some kind of high potent steroids or immunosuppressants. But all these things are given under a strict observation after proper blood tests and proper documentation of the series of events, like how the patches are they getting new patches with that or not. So after all these things, the mini pulse doses are given. And if you are going for a Soralins also, we do a liver function test because there are reported cases of acute liver damage with Soralins. So all these things are documented and then started with the medical therapy. So medical therapy is also a long thing, and with the medical therapy we can also include some surgical or the phototherapy, like a combination therapy. People can take oral and topical medicines, and they can also go for a phototherapy either with an ultraviolet or an ultraviolet B. So most commonly used radiation is the narrowband UVB in the treatment of vitiligo. So narrowband UVB, between the wavelength of 310 315, supposedly very safe and approved for the treatment. And this is also had to be repeated at least 3 to 4 sessions in a week for a period of time to see the results. And basically, the patient is wherever there is no lesion is protected with the sunscreen, the eyes are protected, and the patient is sent into a chamber. A chamber is a small place which is surrounded with the tube lights, like a fluorescent lights, which has about 100 watts of power. So there are different types of chambers depending on the clinic. They can either have UVB, or there are chambers which has both UVA and UVB, and your doctor will select according to the need. So, and the patient is exposed to the light for few seconds to few minutes, depending on their session. And before starting the treatment, the minimal erythemal dose, which is calculated, in which we are expecting a mild redness, very mild redness. From there, we'll start our dosage. So, what we are expecting is a asymptomatic mild erythema to start the repigmentation. Anything more severe than that, you have to be reported and treated properly. Like people can get very like a red rash or even blistering and crusting of the skin. All those things, if happens, it is treated, and then the doses adjust accordingly. So everything will be documented and given to you as a sheet and followed properly. Uh, if if there is a stable as such said, there is no stability in vitiligo, but for a many number of years, if your patch is not growing in number or in size, then we go for this surgical methods as Sar mentioned. But even with the surgical method, we don't see the result immediately. Like it doesn't mean if you're doing a surgery, the next day it will be repigmented. So even after the surgical treatments, also we advise the patient to continue their medical treatments like a phototherapy or the tablets or whatever they are on. We advise them to continue that. And this is the in brief about the medical management. And there are also many newer developments in the medicine. Newer drugs has proposed, like biologics are there. There are medicines that are targeting interleukins, specific interleukins, which are considered as memory cells, which are affecting the permanent results in vitiligo. So there are a lot of studies and researches going on. Hopefully, in the near future, we'll have a more definite treatment for vitiligo. But as of now, we don't have a permanent cure for it. We can minimize it, and we can give a better cosmetological appearance to the patient. And the other important thing is a camouflage. So if it is facial, acrofacial, or if they are going for a job and they have this inhibition, then they can always camouflage it with a color which approximately matches their skin color. So that is one of the thing that also we advise. And there is also tattooing, which is not very advisable because tattooing itself is an injury, and there are also chances of color depigmentation after tattooing. But to some people, if they have a very small tiny patch, and they can also go for a tattooing. So these are the other things that can cover up the vitiligo. So this is a very brief, very brief session on the management of with medical management of vitiligo, and we are also going to have a small discussion on the myths and facts. Since vitiligo is an ancient disease, it's been there for a long time, and a lot of home remedies and other methods of treatment is more obviously involved, mostly in vitiligo. So we want to just give you some frequently used misconceptions on vitiligo. And for that, Dr. Jyoti will be joining us to talk about the myths and facts of vitiligo.
Okay, thank you. We all know that vitiligo is a very harmless condition. The affected person has no symptoms, has no health problems associated with vitiligo. But still, the moment the word vitiligo is used, everybody is scared. Why? Because there is a stigma associated with the disease. People consider the affected person as an outcast. So that is the fear everybody has in their mind. Am I audible?
Yes, yes.
Okay. So there are several myths or misconceptions associated with this disease. I think this is the disease which has most uh, wrong ideas about it in dermatology. So the first one is people think that this is an infectious disease. That the first thing they come to their mind. So that is a myth because Vitiligo, as you know, is not an infection and it's not a contagious disease, and nobody can catch it from another person. So you don't have to fear anything about the infectivity, because if any of your family member is affected, don't treat that person as an outcast. Then the second myth is vitiligo is it affects only the dark skinned persons, dark skinned people. That is another myth. It can affect, as sir said, it can affect any age, any gender, any race. The only thing is it is more visible in dark skinned people, that's all. Then the third myth is people consider vitiligo as leprosy. They think that both are the same disease, because in Hindi they call it as Venkusht, I think. Even in Tamil they call the name is Venkushtam. So this
Yeah,
Kushtam is
Safed,
related to
Safed Dog
leprosy.
in Hindi. Safed Dog also they call.
Yeah, Safed. So
Yeah.
people think that both are same. So please remember that both are two different diseases, and vitiligo is not an infection. And another myth is the vitiligo happens because of your wrongdoings. That is another wrong idea people have. If you do something wrong, or if you do something bad, as a result of that you are getting this disease. So it has nothing to do with that, and mostly, as we know, it's an autoimmune disease where your own body, like your body's immune system is like destroying your melanocytes. Then another thing is people consider vitiligo as something like which, if your parents are affected, definitely the children will get affected. It's not like that. So when you seek like alliance, especially the boy or the girl, if that person is having vitiligo, definitely they will get rejected, because this is the main fear, that their kids will have vitiligo. So that is also not true, because you can get vitiligo even without any hereditary reasons, and you may not get it even if your parent is affected. So that is another one. So many myths are associated with this disease. So please remember that vitiligo. Then yeah, that one more is that people consider vitiligo as an incurable disease. Like once you have it, then it's like a death sentence. It's not like that. There are several treatments, several new modalities of treatment. Especially if you have a localized disease, you can get a very good improvement. So please don't get depressed when you have vitiligo. Please consult a doctor and get proper treatment. Don't go for other natural or indigenous treatments which can harm your skin. Thank you.
Yeah.
Thank you, doctor. Thank you for that. And we do have questions coming in. The first question is, will vitiligo recur after a laser treatment, or will it be cured permanently? So would you like to answer for that? Will a laser treatment cure the vitiligo permanently?
Yeah, of course. There's no cure for vitiligo, but we can arrest the progress, and also we can give some confidence to the patient. If it is smaller lesion, then we can treat. But we cannot use the term cure for vitiligo. So anytime it can recur. So the idea is to stop the progression of the disease and to even out the color. So whatever the color is normal to them may be acceptable for them. So that's how we can cure. And laser treatment is like laser treatment, phototherapy, that all can hasten the treatment process. So medical line alone may not be sufficient at times. For that patients, we can start phototherapy or laser treatment. Then they will get faster results. So wherever you are, because if it is a eczema spot lasers, then only that area will be treated. Underlying diseases we are not treating, because vitiligo may be associated with some other autoimmune diseases like thyroid or SLD, or how many autoimmune diseases are there. So we'll have to investigate, we have to treat them that also.
What about the childhood vitiligo that was not mentioned in the presentation?
Yeah, since vitiligo is a big topic, what we thought was like, no, we'll give some awareness, and any questions comes up on that, we'll answer. That's what we mentioned. Ask anything, ask us anything, we are ready to answer. So if you want to mention, add something on to vitiligo in children, please go ahead, Dr. Jyoti.
Any age, like as already mentioned, it can affect people of any age. We have seen very small kids, young, like adolescents, all these people coming with white patches. Uh, the treatment is basically the same. Only thing is, um, the certain medications, like certain tablets, we can't give to children. That's all. Apart from that, basically the treatment course, everything will be same. Only thing we need to consider is it's their growing period. So anything which can harm that growth should not be there in the treatment. So we usually manage with phototherapy, which is relatively safer. Especially this UVB phototherapy doesn't require any medications. So that will be an ideal choice for children.
Yeah, preschool children also, the narrowband UV can be delivered. And yeah, social stigma is still around. So people, children with vitiligo, they'll be considered as having some, as you mentioned, correctly mentioned, they think that that is one of the myths. It is contagious. It is infectious. It can spread from one person to another person. That is the myth still going around. So many of the patients in the so many studies have shown that people with vitiligo, around 20 to 30% patients are uneducated people. So that is the reason the stigma is still around. So we are here, like some other people who want to give education on vitiligo or any other skin diseases. We have to tell, we have to educate them, and we have to spread the news that vitiligo is not a contagious disease. It won't spread from one person to another person. And if you want to, people behave or take this disease in different ways. Some people take it easy. It is just a change in color. What's wrong with that? It's not that when you touch that person, you won't get vitiligo. There's just a change in color. We do tattooing in some part of the body. There's a change in color. And if you change the color of the hair, some highlighting, then that was changing color. So this is considered as disease. Of course, any disruption to the normal activities known as disease. So in that way, it is called as disease. So we can be treated. When the disease can be treated. We can treat the disease. We can control the disease, and if the patient can live with the disease, that's also okay.
Is there
So
any home remedy which can be done in the starting stages? Neetu is asking.
yeah, Priya can answer that.
Well, there is no home remedy, but many other treatments like Siddha, Ayurveda, a lot of other things work for vitiligo in the basis that most of them use a photosensitizer like Soralins in the form of an application or a tablet. So any treatment apart from allopathy given to vitiligo is based on giving some photosensitizing agents. So that can work. But home remedy basically like exposing to sunlight. But there is no a specific method that can stop you from getting a vitiligo patch. So there is nothing to prevent it from coming. Especially when a child gets the vitiligo, the fear of the parents will be as it's a growing person. Like with the person, the patches, the extent of the patches will also grow. That is the thing, and they or their aim or their they want that patch to stop. That will be the foremost concern. But there is no specific home remedy to stop it from coming or prevent it from spreading. But as I said, most of these photosensitizers will give result as good as an allopathy sometimes.
Mr. Kannan asked, autoimmune disease transmitted through gene. I don't know what actually the question is not fully clear, I think.
Or maybe that he wanted to know what are
Vivek
the
can
other
answer.
autoimmune diseases
So it is
associated
a
with it.
genetically transmitted autoimmune disease. That is what he's trying to ask.
Yeah, it is. It can be associated with the rheumatoid arthritis, diabetes mellitus, especially type 2, and psoriasis, and pernicious anemia, and Addison disease, and SLE. All are autoimmune diseases. So maybe it's all gene related. Yes, it can be. That's the thing, the new method. We are targeting to inhibit IL-15. That's the latest research going on. The memory cells Dr. Priya has been explaining. That's the thing. So there's still plenty of hope. So we all should be fighters, and vitiligo patients should be fighters. If they want, they can live with their white patches on the so small areas, or even the. Actually, what in my opinion is, if I have vitiligo, I'll live with it. That cannot be the mindset for everybody, because we know about vitiligo. We know that it's not infectious, and we know that it won't harm your health in any way, anyways. Just a change in color. If we can live with it, that will be the best part. If you have major part of the skin has been affected, if you have more patches and it's so-called stable, then you can go for treatment. There are excellent treatment. We have shown the photographs. Follow-up photographs also we have after 4 years, 5 years. And then we have not seen any recurrence. As we said, nothing is unstable. Nothing is stable in vitiligo.
Then diet and vitiligo connection. That is the most common doubt everybody will be having now.
Yeah. When we do our postgraduate studies, we have been taught, when we have read lot of books regarding that, everywhere it is mentioned there is no relation. But the practice, when it comes to the real practice, common practice, then we'll come to know that there are certain people will come to us and telling that after taking lime or citrus fruits is getting aggravated, or spicy food, all this. So we don't know the exact relation with the food, I mean the diet and the vitiligo, but it's always better to avoid food which causes inflammation in our body. Especially it is destroying the melanocytes. So if you give more inflammation to our body, that can help in destroying more melanocytes. So it is better to avoid milk, dairy milk, and so dairy products and dairies and dairy products, curd, citrus fruits. There is a common, most common food we can avoid. Then you
But
should.
restrictions are not advisable, especially for kids, as it is their growing period. These parents, they will have so much fear. They will restrict so many foods.
Yes. So actually, there is no need to restrict any food for vitiligo, and as Sir mentioned, it is just named as disease, but actually it is not a disease. Um, since we are doctors, we were talking about the treatments and various newer methods, surgeries, and all those things. But as Sir mentioned, if you're okay with having a white patch, you can very well carry it with your own confidence. And there are many people with vitiligo who doesn't do any treatment and they carry it well. And it all depends on your mindset and confidence. So, along with all the treatments, what we have mentioned, uh, the person and the persons with the person who is affected with this problem should have a proper counseling and an approach to this disease. which is more important, because this is not something that is going to be there for a very short time. This is going to be there for a longer time in their life, and they have to have a full knowledge and an acceptance and a counseling to that, and self confidence to carry it, and the knowledge of why it is happening, how is it happening, and all those things will tremendously help more than the treatment modalities. So though we talked about all the treatments, we don't really encourage everyone to go for a treatment. It should be absolutely your choice. You have to choose what treatment you want, whether you want it or not. It should be your choice. And I think we have covered briefly about all the major concerns and of vitiligo, what vitiligo is, and the latest treatments, especially the procedures for all those people who are interested in procedures and willing to start it. Maybe on seeing these videos, you could have had that confidence or an excitement to start doing it at your clinic if any doctors are watching. And we will always welcome all your questions, not just on these Zoom on these live meetings. Even you can post it on our Insta page, or you can go to our website and you can post your questions, or any kind of information you want regarding the treatment or the training to the procedures. Anytime you can get to us, and we'll respond as quickly as possible. And this has been a very good session. Thank you, both doctors, Dr. Taj and Dr. Jyoti, for this. And since we are running out of time, we are going to stop it from here, and we'll continue this on the next Sunday with another interesting topic. And if you want any specific topic, you can also post it in our Insta page or in our website about this, or in the YouTube, and we'll respond to it. I think we had a good session. Thank you all for joining us today. Thank you, doctors, and we'll see you on next Sunday with the exciting topic, 7 p.m. exactly. Thank you so much for joining us live. Thank you. Bye.
Bye bye.
Thank you. Good night.
Good night.
Night.